Hello, I'm going to talk to you today about varicose veins. They're a very common condition. They affect approximately 1 in 3 people. There's a family history often associated with it and affects people who stand on their feet a lot and also people who've had children. People I see, generally from the public, complain of swelling in their legs, aching, particularly at the end of the day. They often see bulging veins in their legs and discoloration, and often can talk about symptoms such as burning or itching or skin changes in their legs. Varicose veins can be associated with other conditions such as deep vein thrombosis or trauma to the lower limb. However, can also be associated with no symptoms at all and can be cosmetic in appearance. There are a number of techniques of treating varicose veins, but the first treatment will be to see a consultant for history and examination. In the examination, we'll look at the distribution of the veins. There are many veins in the lower limb, and there are specific veins that are commonly affected by varicose veins, and we'll go through this with you. Varicose veins are usually problems to do with veins, which are essentially the drainage system of the lower limb. They can occur in the upper limb, but less so. Veins carry blood back up to the heart for oxygenation, and as a result of travelling from the legs up to the heart, have to fight against gravity. Ways they do this are with the muscle pumps of the calf, and also veins contain valves to keep blood up. When the valves aren't functioning properly, patients then start to suffer and see signs and symptoms of varicose veins. The treatments of varicose veins traditionally have been conventional open surgery, which have involved general anaesthetic and more recovery times. However, now we offer image-guided surgery using ultrasound and endovenous or keyhole techniques. These techniques require minimal time away from work. You can return to work the same day or day after, and they include ablating the vein with laser or a heat technique, or injecting foam to seal the vein and cause an inflammatory reaction which seals it, or removing the veins through small incisions. There are other techniques, but these are the most common offered. With varicose vein surgery, patients often see much more success from the endovenous keyhole techniques and less recurrence than with traditional open techniques, which we've moved away from. And these techniques are conducted, often can be in a clinic or operating theatre, under local anaesthetic with sedation and avoiding general anaesthetic. When you're coming to have your varicose vein surgery, be it foam under ultrasound guidance, phlebectomies or removal through small holes, or laser or endovenous ablation of a vein, first thing would be you'd attend the hospital starved of food. This is in case you feel unwell. The worst place to be unwell is on an operating table, so we prepare for all eventualities. The majority of surgery is performed under local anaesthetic with sedation, if required, and we can use a general anaesthetic if you're starved in that case. We admit you 1 hour before the surgery, meet you, mark your varicose veins that you want treated and trouble you most, and we'll go through the consent process of the risks and benefits of a surgery and common complications. Once we have your permission to conduct the surgery, we will then either perform the surgery in an operating theatre or a clinic room or a minor procedures theatre. The surgery takes approximately anything from half an hour to 45 minutes, and once we've performed the surgery, we'll allow you to recover, make sure you're okay, and we hope that you walk out of the operating theatre or clinic room and go home shortly afterwards. You can return back to normal activities the day after or the same day if you wish, and that's important because the quicker you return to normality, the quicker you recover. So the risk associated with all the varicose vein procedures can be risk associated with surgery as a generality and also specific to the procedure. The risks are rare, however they do occur, and we give prophylactic antibiotics to cover you for infections, and depending on specifically your tailor-made case, we may give you blood thinners after the surgery if you require them. Follow-up occurs after surgery to make sure you're okay and your symptoms have been treated and you're recovering, and bandages are worn for a variety of different times, usually for 2 weeks and 2 days in my practice.